Okay, so I've inspected my patient's chart to look for code status and allergies. He is a full code. He has no allergies listed in his chart. I've gathered my supplies, which is my stethoscope and my pen light. And I'm going to enter my patient's room.
Come in.
Okay, and I will hand sanitize on my way through the door. Foam in, foam out, so I'm foaming in. Hi, my name's Catherine. I'm going to be your nurse today. Can I get your name and date of birth?
Emmanuel Yates, January 2nd, 1989.
Okay, I'm going to compare that to the wristband. That sounds about right. Okay, so today I'm going to be performing a physical assessment on you. Is that all right?
Yes.
Okay. Can you go ahead and tell me where you are right now?
The hospital.
Okay, that sounds about right. Do you know what date it is?
It is March 7th, 2019.
Okay, and what day of the week?
It is a Thursday.
All right. Do you know who the president is?
Donald J. Trump.
All right. All that adds up. So I'm going to perform hand hygiene one more time. I'm going to put on my gloves. Okay, put on my gloves. So your tone sounds appropriate and even. Just put my gloves on real quick. Your outward appearance is clean and well groomed. I don't see any obvious deformities right off the bat. So I'm just going to take a look at your head, okay? I'm going to inspect the head first. Once again, I don't see any obvious deformities. I'm going to go ahead and palpate. Okay, so I'm just feeling your head right now for any masses, going through your hair, looking for any like debris or lice. Everything looks appropriate. I felt no masses. I'm just going to take a look at your face, your eyebrows, and your eyelashes. All that looks evenly dispersed. I'm going to shine this light in your eye, okay? All right, pupils are reactive to light. I'm going to hold this right here, and I'd like you to look at the wall behind me, and then look at this pin light in front of you. Okay, I'm going to move this closer. Just watch the pin light. Okay, eye movements are symmetrical. I'm going to take a look at your ears. I don't see any buildup. I don't feel any masses there. They look clean and clear. I'm going to take a look up your nose here. Okay. With your mouth closed, can you breathe in and out? Very good. With your mouth closed, can you breathe in and out? Very good. I'm going to go ahead and ask you to open up your mouth for me. Okay. I see no missing teeth. The tongue and the gums look moist and pink. Oh, you're a little tired? Can you go ahead and smile for me? Oh, it's a beautiful smile. That's nice. Okay. Can you, I'm going to check for symmetry of facial movements. Can you lift or raise your eyebrows for me? And then go ahead and put them down. Close your eyes tight. That's great. And can you smile for me? You can go ahead and open your eyes and smile. There you go. Okay, that looks really good. All right, so now I am going to make my way down. I'm first going to inspect your trachea. It looks like it is midline where it's supposed to be. I'm going to inspect your chest. Right off the bat, I don't see anything inappropriate. I'm going to go ahead and take a listen to your heart and your lungs, okay?
Yep.
So I'm going to start by listening to your heart in several locations, okay? Listening for S1 and S2. Moving over here. or assess your apical pulse for 60 seconds. That's how long I would listen here. Okay, and I'm going to take listen to your lung sounds as well, okay? I'm going to do 6 sounds on the front of your chest, 2 laterally, and then 8 positions on your back. So let's go ahead and start that. And can you just take a deep breath for me? That's great. Listen here. And on this side. Okay, and I'm gonna, can you lean forward for me? I'm just listen to your back. That's good right there. The lung sounds clear and even, and I would go ahead and when I first inspect it, I would look at your breathing, make sure that your chest is rising and falling like symmetrically. I could place like my hand here just to make sure that it is rising and falling and that it has like a nice even pattern on both sides. So I've inspected your chest. I have auscultated. I am going to palpate. So I'm going to just kind of gently feel around on your chest for any lumps, any masses. Okay, everything feels normal there. I'm going to move down to your abdomen. That's what I'm going to do next. I'm going to first inspect your abdomen. So I would look at it for any, like, once again, obvious deformities, any wounds or scars. Everything looks fine there. So I'm going to listen to sounds in all 4 quadrants. And I'd listen for like 10 to 15 seconds in each quadrant. I hear sound in all 4 quadrants. I would palpate your abdomen, feeling for any masses, whether or not your bladder is distended. Everything feels normal there. So I'm going to go ahead and assess your pulses, your perfusion. I'm going to start with your carotid. Right there. And then on the other side. Okay. And then I can move down to your radial pulses, which I can assess those at the same time. Okay. And then I can assess your brachial pulses. Making sure not to press too hard. I could feel your femoral pulse, which is in your groin on each side there. Your popliteal pulses, which are located here behind me. Could you stretch your knees out for me? Okay, those are both located right behind the knee. And the pedal pulses right here on top of the feet. And then the tibial pulses, which are also down by the feet. You can see. Okay, so now I'm going to just look at your skin for perfusion. So it is pink, it is warm. You can test for capillary refill. Just kind of squeeze one of these and the color comes back immediately. I can also check for capillary refill on your toes. Okay, your skin appears normal. It's not overly dry. You seem moisturized. I can check your skin turgor by checking for tinting. Okay, there's no tinting noted. So I am going to just do an all over skin assessment. And I don't see anything out of the ordinary. Your skin is all intact. There are no wounds, no scarring, no sores. Can you go ahead and put your feet out for me again? Okay, all of that looks pretty good. I'm going to check or assess your perineal region. I'm going to verbalize this. I would check your genitals, your groin, your rectum for any discharge, lesions, ulcers and sores. Everything looks fine. Protrusions, but nothing noted right there. So I'm going to go ahead and do a musculoskeletal assessment at this point. And to do that, I am going to have you turn your head towards my hand. There you go. And then this side as well. Okay, very good. And can you shrug up against my shoulders? Okay, awesome. Can you place your arms up and just press up against me? That's great, and then we'll flip it and press down against me. Okay, that feels good, and press out. Okay, and press in. All right, all of that feels normal. So I'm gonna have you stand up. And can you, okay, you're standing tall, everything looks symmetrical. Can you raise your arms up? Very nice. Can you just go ahead and bend your elbows? Very good. Can you move your head just slowly to that side and then to the other side? Then go ahead and go forward and then go back. Okay, very nice. Can you, I'm right here, can you see me better? Can you go ahead and just like raise one knee up and then raise the other, put that one down, you have to raise the other one up. Okay, very good. And can you go ahead and just bend over and touch your toes? Very nice. You can see, oh, hold on one second, almost done. The spine looks good. Okay, you can go ahead and stand up straight for me. Do you feel all right now? You're doing good? Okay. I'm gonna have you kind of just, I'm gonna assess your hips. So if you can, just put one, can you go out for me with one leg? Very good. And then can you go back with one leg? All right, bring it forward and up and then down. Let's do the other leg out. There you go. And then back in and then up and then back. Okay, great. Can you put your arms out straight for me? Hands apart, and just kind of like push your fingers towards you as much as you can. Pull them towards you. And then put your wrists down. Very nice. Okay, I'm gonna have you sit down again. And I'm just gonna have you push your feet, like put your heels up or put your heel on the ground, toes up, and then just kind of like press down like you're pressing the gas pedal. Yeah, that looks good. And then the last thing I'm going to assess is your gait. So I'm going to have you stand up and then just walk about 5 feet in front of, yep, just like that. And then turn around and just walk on back. Okay, very nice. Go ahead and have a seat. Okay, that was our full physical assessment. You did great. Thank you for cooperating with all of that. I'm going to go ahead and give you your call light Make sure that you're comfortable in the bed. Let me just like take off my gloves actually. Take off my gloves, perform hand hygiene. And throw my gloves away, perform hand hygiene. I'm gonna make sure that you're comfortable. Your bed is low, your rails are high, your wheels are locked. You have your call light, you know how to use it?
Yes.
Okay, and I'm going to perform hand hygiene one more time and then document this assessment. Thank you.